Community health centers serve any patient who walks in the door. In North Carolina, community health centers serve about 500,000 people per year, regardless of insurance status. 41% of community health center patients are uninsured. This is the story of one of those patients and her healthcare provider at United Health Centers in Winston-Salem.
My name is Emily McNair. I'm a nurse practitioner, and I have a really good success story. She is a patient that came to us without insurance, and she was a known diabetic, but had been off of her medications for many months, almost a year. Her blood sugars were out of control. She just simply could not afford them. She'd lost her insurance through a loss of a job.
Belinda was a flight attendant, but had to stop flying when she was diagnosed with cancer and needed to undergo chemotherapy. Because of that, she lost her insurance, but she continued to work as a substitute teacher until her mother's dementia reached a stage where Belinda had to move in and become a full time caretaker.
Well, my name is Belinda Basket, and the health center that I went to is this one right here. And I have what, diabetes and high blood pressure. When I came for my first visit, I met Miss Emily McNair. That lady's got such a beautiful spirit. I mean, it's like she actually made me feel like she cared what happened to me.
And so she came to us. We got her back on some medication, and her blood sugars right now are at an undetectable levels. She's done an excellent job. She's not just taking the medication. She jumped in 100% with her with her diet, and with her exercise. She's started a little garden. But she's done an excellent job, and she comes in now to her appointments with a notebook this big with all of her information. And I've actually said to her, I'm going to have you start teaching my diabetes education classes.
Now, when I went to visit her the last time, my A1C was 5.6.
That's
Okay, my blood pressure is down. My sugar is. I'm. I go to see her next month, and I'm hoping she can tell me I don't have to take my blood pressure and my sugar medicine anymore because I'm doing the right things.
Emily knows that her patients are often dealing with many things outside of the exam room that affect their health.
I hope that they know that there are a lot of people out here who are uninsured or underinsured, and that they're making sacrifices to be the consumer, to be the advocate that they can be for themselves and for their family. And unfortunately, that sometimes healthcare falls by the wayside. So, for an example, if you're a mom or a dad, you're more concerned about your children's health than you are your own. But unfortunately, that impacts the whole family, because if mom or dad gets sick and they can't work, they don't have insurance, they don't have sick days, then that ultimately domino effects on the whole family. So I think it's important for them to understand that, you're looking at not just one person who doesn't have insurance, but you're looking at someone with that one person doesn't have insurance that will impact a whole family, if not a whole community.
For many like Belinda, who had a job and lost it because of their health condition, community health centers are a vital resource in ensuring that hardworking people who take care of others get the care they need themselves.